Hello, everybody, and welcome to another Community Conversations here on WHBG Channel 20 and Facebook Live. I'm Mayor Eric Papenfuss, and thank you for joining us. Today's topic is Back to School Part 2. Last week we had a great show with the school district, and today we are going to continue the conversation on returning to school safely and community involvement by entering into a conversation with a number of very important guests. We have Representative Patty Kim here with us to discuss her Community Classrooms Initiative. We have Ms. Laura Hughes, who is the Executive Director of the Central Pennsylvania Chapter of the American Red Cross, who's going to talk to us a little bit about what the Red Cross is doing. And we are joined by Janine Peterson, CEO, and Kim Craig, the Community Program Manager for Hamilton Health. And among other issues, we're going to talk a little bit about a free testing option for Harrisburg residents, which Hamilton has been pioneering. So those are the topics of today's show. Next week, we're going to return to the issue of policing reform, and I'm pleased to say, among other things, I'm going to give an 8 Can't Wait update, and we're going to talk a little bit, hopefully with Council President Asha Green, about her reflections on the recent series of town halls that City Council had over the summer, and where we stand with the Police Advisory Reform Bill. We'll also be joined by some guests from the county to talk about an important program called the Co-Responder Program, and all that is upcoming. By way of a few general announcements, I want to let people know that City Council is back in session, although virtually, this coming Tuesday, and it'll be an opportunity to introduce a whole number of new things. It's been a busy summer. Not only has there been talk of policing reform, but also we've been hard at work on some affordable housing initiatives, which we will discuss at a future Facebook Live as well. And you can expect to see some affordable housing reforms proposed this fall. Some breaking news, we have decided to extend the Saturday Nights in the City initiative through the month of September. There's been a lot of demand for this. Restaurants, as you know, are really hurting in terms of the allowed capacity indoors, so allowing them to expand out into the streets for public dining outside has been a real boost for them. And we will be continuing that through September. This will be the last extension, but it gives people another series of weeks to get out and support some of your favorite restaurants in Harrisburg. And on that note, the Choose HBG Shop Local campaign has been going extremely well. We're up to 70 small business participants. You can find out more about them if you go to the website, harrisburgpa.gov/choosehbg. And the campaign has been doing a lot of digital advertising and newsletters and all sorts of things. Again, if you follow me on social media and you look at for the hashtag ChooseHBG, you know that I've been stopping by and supporting many of them, and I encourage people to continue to shop local. We've got one more week of the August campaign for Choose HBG, so let's close it out strong, and I encourage everybody to be supportive. Tonight is the final movie for our Reservoir Park free movie series, and tonight we are concluding with Black Panther at 8 p.m., so I hope everybody can make it out to Reservoir Park for Black Panther. And in another general note, upcoming, we'll have more on this in a future show, but Capona this year is going to be mostly virtual, although we will have one day of fireworks and food trucks, much like we did on the 4th of July. And we'll talk more about what that's going to mean, but there will be a Capona, and that'll be coming up here soon. Also, in terms of a general announcement, next week we are going to be dedicating the African American Monument that we talked about on a previous show here in Harrisburg. That's going to be an exciting event. I'll talk more about that next week, and we're really, really proud and pleased to be seeing that monument dedicated here in Harrisburg. Finally, I want to end on an extremely positive note. As many of you know, we've been following the BioBot wastewater data, which measures the amount of the prevalence of the virus in Harrisburg's wastewater. And we got the strongest report that we've received yet since we began the BioBot testing. now, way back in May, and that shows that that the levels, at least levels as measured in the wastewater, are down to under a 2.5% incidence rate, which is very low compared to where we were, and indeed down even significantly by more than 50% since the last test. So those are the most recent results as of August 16th. They definitely show improvement in Harrisburg and our region, and it's good news, especially as we return to school, and we're trying to return to school safely. We're not through the woods yet, but if we can show a few sustained weeks with that low an incidence level, that will be very good news for everyone. All right, I want to turn now to Representative Patty Kim, who was kind enough to join us here this morning to talk about this wonderful new initiative called Community Classrooms. And Patty, we spoke to the superintendent and the chief academic officer of the Harrisburg School District last week, and they had a lot of good things to say. But one of the concerns of the community was how this exactly is going to work if we're going 100% virtual when you have working parents and we're struggling with issues such as internet connectivity and everything else. So you have a very innovative solution. It's called Community Classrooms. You want to talk a little bit about what it is and why you came to this particular solution?
Sure. Thank you, Mayor, for allowing me to talk a little bit more about Community Classrooms. I do want to get the word out. I think this is a program that will help some parents who can't stay home because they can't telework and need to go into work physically. And if you have school-age students, elementary school students, who's going to watch them? I'm a parent myself, and I just remember how hard it was to find quality daycare. It was expensive, and if you're tight on money, full day daycare is not an option for some parents. So I thought of trying to find a safe place for students who have to work remotely, which all Harrisburg students and Stilton High Spire actually has also gone virtually online 100%. And I just made out a call, Mayor, and it was so encouraging to get organizations like the Whitaker Center, the Jewish Community Center, and other churches saying, you know what, our buildings are empty, or we had just a successful summer camp at the JCC or Whitaker Center. Kids were healthy the whole time. We have everything in place. We have the guidelines. We want to open our doors. And so I talked with the Harrisburg School District, Dr. Sneed specifically saying, when is the hours where the students will have instructional time? And she told me from 8:50 a.m. to 11 a.m. Well, those are the hours then. So we're opening our doors from 8 a.m. to 11 a.m. There will be about 8 locations. We are still in the process. Some of the churches who want to host a site are asking their boards right now. They're asking questions to make sure that they're getting everything, all the details in place before they approve. So I don't feel like letting you guys talk about the locations right now. But it's all volunteer based. There's no funding for this. I, as a state representative for Harrisburg School District, I'm just the convener. Chad Fry with Planning Partnerships put together the website. So communityclassrooms.org. All you need, if you want to be a host site, sign up there. If you have a student, sign up there. And if you want to be a volunteer, sign up there. So we have everything in place. Everyone pivoted real quickly, and hopefully we can provide a safe place for our students in the next at least 3 months.
Yeah, it's such a wonderful idea, and it's something that that I think we really need. It's a great opportunity for organizations to come together and work under one umbrella to help create these sort of safe learning spaces for our students from 8 a.m. to 11 a.m. during the work week. I did go to the website, communityclassrooms.org. It's a great website, and one of the things that it has on the website is a map. So if you'd like to know where the closest classroom is to you, you can go to the map. You can click on it, and you can see. And you've mentioned some of them: the Jewish Community Center, the Whitaker Center, the Journey Church, Pastor Sledge, and others are all stepping up to make this possible. I think that's terrific. So if you're a parent, you do, however, have to sign up for this, right? It's not a just sort of drop by or come by type of thing. We've got a plan for it in order to make sure that everybody is safe and we don't exceed capacity. So what's the proper way to go about signing up? And is there currently room for anyone who's watching and interested in taking advantage of this?
Sure, great questions. I did want to add to the list of host sites. I was so grateful for the Harrisburg Housing Authority.
Mm-hmm.
They're going to use 3 of their sites, Hall Manor, Cooperter Homes, and William Howard Day. They're going to be putting out outdoor tents because we feel it's going to be safer. Their community rooms aren't that big. And it will be for residents, students of residents only. And I know that I'm so hard on myself. Like, I want to help so many people. I want to help everyone. But I know that transportation is going to be an issue. We're not providing busing for the community classroom students. So I'm really excited for the Harrisburg Housing Authority because those locations are walkable for the students. And, if we need to have a chaperone or walk them back home, we're happy to do that with the volunteers. So you had mentioned, we're going to cap or close the enrollment by next Thursday. We want to make sure that each site has 20 students or less. And we want to space them out. We don't want to have 40, 50 kids all in one room. So as we get more sites, we can start designating different areas. And right now we have about 50 students. Harrisburg Housing Authority has their own sign up. So I don't know how many students, but when they did a survey in 2 days, 70 parents said, we need this service. So I have a feeling it's going to get up to 100.
Representative, I will jump in here because we had a little problem with the connection there right at the end, and you're breaking up a little bit on us, but we'll give it a second to see if we can restore that. I know.
Of the school, host sites will get a list of the students, so we can expect your child. This is not going to be willy-nilly.
Again, having some technical difficulties, I think, with the sound. But the bottom line from that was there is room to sign up. Sign up is required, and indeed, people should be able to sign up really all the way into next week through next Thursday. There's room at each of the various sites. You're going to try and keep the capacity of the sites. I'm just giving a little update. We had some sound problems, but we got most of the important points conveyed. And it's good to know that there's space, and there's also been a lot of enthusiasm. And it's great that the Housing Authority has stepped up as well, and I know there are other locations you're going to add. So the best thing for parents really is to go to the communityclassrooms.org website, to use that as a means of seeing the latest sites and for signing up. I did, and I'm glad the response has been so strong. I did want to talk about one other aspect of the program, if our technology is going to allow, and that is you've also put out a call for volunteers, and I wonder what that's about, and how the volunteers are going to be integrated into this sort of virtual learning.
Sure. So is my audio good now? I don't want to.
Yeah, that's good.
Yep,
good.
Great. So what we require the volunteers is to, again, go to the website, but they have to show proof of clearances to work with children. And I am looking for folks who want to give back to the community, who may be teleworking and can have some flexibility in their time to spend about 3 hours during the day with the students. Because a lot of the instruction is happening online, volunteers do not have to teach or tutor. They're basically just there to supervise and make sure the students stay in their seats and listen to the teacher on their devices. And so I think it's just going to be a really good opportunity for, a lot of these parents are first responders or, essential workers, that this is a way that we can support them and not add more stress to their lives with not knowing where to go with the kids. And in my press conference, I called that these volunteers could potentially be, the heroes during this pandemic. And I really encourage people, if you have the clearances, if you like to be with kids, to sign up and to help us through these difficult times.
I think it's wonderful that we're doing that. And I don't want to put you on the spot, but are you familiar with the clearance process? Is it a fairly straightforward thing for somebody to get their clearance if they're interested in doing it? And what do they do to get it?
So we're looking for volunteers who already have their certificates and their clearances. So, retired teachers, students who have to work with students anyway, Sunday school teachers and whatnot. There is some time involved to actually apply from the very beginning to get your clearance. So unfortunately, that they may not be the best option because there will be a delay in time. And with the pandemic, I think it's a little bit even, further delayed. So if you have your clearances, we're looking for you and your help.
That's terrific. All right, and if people are watching and they don't have ready access to the internet to get to that communityclassrooms.org website, I know you've put your office number out there, and your office has been very actively sort of integrating people into the thing. Do you want to share that information and any other details that you think the public should know?
Sure. Call our offices, our Klein Village office at 717-772-3570.
Well, Patty, we lost you. We lost you again. That's okay. What we'll do is when we replay this and we put this online, we'll post the phone number so that everybody has that, and everybody can either use that or the website link. And I know you have to go and have some family responsibilities of your own this afternoon. So thank you very much for stopping by and being a part of the show. And we are going to turn next to Ms. Laura Hughes, who is the Executive Director of the Central Pennsylvania chapter of the American Red Cross. And I think we should start with basically just a little general background about the American Red Cross and what it's been doing in light of the current pandemic. Welcome.
Well, thank you for having me, Mayor. My name is Laura Hughes. As mentioned, I'm the Executive Director of the Central Pennsylvania chapter of the Red Cross, which covers 8 counties in Pennsylvania, including Cumberland, Perry, Dauphin, Lebanon, Lancaster, York, Adams, and Franklin counties. The Red Cross is a not-for-profit organization, and we depend on volunteers and the generosity of the American public to perform our mission. Our Red Cross mission includes sheltering, feeding, providing emotional supports for victims of disasters. We supply 40% of patients' blood. We teach CPR, first aid, and other health classes. We provide international humanitarian aid and support military members and their families.
Yeah, so important, and can you and you're always there, the scenes of fires or other disasters, but can you talk a little bit about what you're doing specifically to support the community during this time of COVID-19?
Absolutely. The safety of the community, our staff and volunteer workforce is certainly our priority right now. We are continuing to fulfill our mission, like responding to the home fire and supporting our military community during this time. But we've adapted certain programs, pivoting to a virtual platform for some. We're continuing those health and safety classes like CPR and first aid. We're continuing to collect blood through blood drives. And then throughout the state during this coronavirus pandemic, we've partnered with a lot of local organizations to meet the need of the community. We've supported through feeding, transportation and distribution of food, just to name a few.
Yeah, how has the pandemic affected your efforts to collect blood? And that's such an important thing. I hope it hasn't been more difficult. But how have you adjusted during the pandemic?
Sure. Well, there's always an ongoing need for healthy and well blood donors and blood drives throughout central Pennsylvania. We need this ongoing support and blood drive hosts to ensure the blood products are available for patients battling disease and facing the unexpected. Something that's important, I think, for the individuals to remember is that blood is perishable. It can't be stockpiled. So red blood cells, for example, must be transfused within 42 days and platelets within just 5 days. So we need to constantly replenish that supply.
And so how if I'm watching this and I want to give blood, how do I do it? And is it safe to do? What types of precautions are being taken to make sure that everyone is safe during this health crisis?
Absolutely. Once every 2 seconds, someone needs blood. It can only come from volunteer donors. We cannot manufacture it. So, as we move through this pandemic, we have seen a significant decrease in donor turnout and the ability of different facilities to host drives. So that is our current need. We have amped up some safety precautions and measures to be able to execute our blood drives in the safest manner possible. And we've continued that service throughout this pandemic. For example, we are doing temperature checks for all staff and donors before entering a drive to make sure that they are healthy. So before they even walk through the door, they have a temperature check to ensure that they can safely enter. We are providing hand sanitizer to use before the drives, as well as throughout that donation process. We have adapted our floor plan for each blood drive to follow social distancing between donors at entry, throughout the process of donation, and in the refreshment areas post-donation. Face masks and coverings are being worn by staff and donors, and we're routinely, consistently disinfecting surfaces, equipment, and donor-touched areas. And as always, our staff is wearing gloves and changing them often.
Absolutely. Well, health and safety is at the center of the mission of the Red Cross. We've been talking a lot this week and last week about the return to school. We've got a lot of people that are anxious, and it's a time of transition. And do you have advice? Does the Red Cross have any information that they can share with families that are returning to school? And things are very different this year.
Absolutely. Sending students back to school is definitely different due to this ongoing coronavirus pandemic. At the Red Cross, we focus on helping people prepare, respond, and recover. And part of that prepare piece is issuing a back to school safety tips that we share with the public each year. So if I may just highlight a couple,
Please do.
We know that, everyone's situation is different this year, whether you're going back into the classroom, whether you're doing a hybrid program, or whether you're doing full virtual learning. We understand that it's different for each student and their situation. So we've issued a variety of safety tips depending on your situation, and these can be found at redcross.org. I'm going to highlight a couple for students returning to the classroom this year that I feel are very important. It's important to teach your children safe behaviors at home and about what to expect this coming school year. It's important to check your children's temperature each morning for signs of illness. If your child has a temperature of 100.4 or higher, they should not return to school. I think it's important to review and consistently practice proper hand washing, 20 seconds with warm soapy water, or the equivalent of singing happy birthday twice. And one of the most important things I'd like to stress is developing a routine. We should have a routine for before and for after school. For example, things to pack before school, like hand sanitizer, additional face coverings, and things to do when you return home, like immediately washing your hands and you're washing your worn face cloth for the day. Regarding face coverings, it's important to have multiple face coverings for each child so you can wash them and then you have backups. Label your face coverings with permanent markers so they're not confused with someone else's face mask. It's important, especially for the young ones, let's practice putting them on and taking them off so they're not touching the cloth material in the front. With the young kids as well, they need to get comfortable wearing that face covering. And if parents or guardians can provide them with a container where they can keep and store their masks, that's very, very helpful for the student to know where they are at all times. And again, just as a general reminder, children under the age of 2 should not be wearing a mask due to the risk of suffocation.
Well, some really good advice there, especially the advice about establishing a routine. I think as many people know, the Harrisburg district has decided to go all virtual, but here we were talking about these community classrooms where parents can potentially drop off their kids for learning in the mornings from 8 to 11, which is a bit like going back to school in the sense that people should not be dropping off their children if they have a temperature. They should be bringing their mask. They should be performing a sort of regular scheduled health and hygiene checks as part of the day. I know in certain private schools and other school districts in the viewing area, there's a hybrid schedule where some are going back and others aren't. So there's a lot of decisions to be made, but it seems like the common theme is that you have to be prepared. You have to be conscious of some of the things you need to do. Do you have sort of a key advice that you give families in an even more general sense about how to approach going back to school?
Absolutely. I think the most important thing to remember is stay connected with your local school district. Know how and where to get the updates and information on what back to school looks like for your child. That's the most important thing I can stress, as it is different for each district this year. And again, for more safety tips, I encourage everyone to visit redcross.org to learn a little bit more, given your students' back to school experience.
Okay, well, thank you for those back to school updates. I'll maybe we could just briefly address disaster relief as well. I know that the Red Cross constantly on the scene of, for instance, fires in the city, constantly working with our fire department. Can you talk a little bit about your disaster relief efforts and how they've been able to continue even in this time of COVID-19?
Yeah, absolutely. Our volunteers are phenomenal here with the Red Cross. And even through this pandemic, they have been phenomenal in working with us and responding to all of these home fires and emergency situations. Our team of volunteers are still operating business as usual. However, we have put in practice certain safety protocols for them. So our disaster action team is able to service the client when an emergency breaks out, either virtually or practicing social distance with their proper PPE. We're able to do a lot of our work with that response virtually. In addition, we're able to make sure that they're able to get back on their feet with ongoing casework in the immediate aftermath of a disaster in those days leading into after their disaster, and we're able to ensure that we can reach them virtually to do all that casework to make sure that they can find a more permanent solution for housing if they don't have one. Our team has been wonderful. We have a COVID strike team, we call it, that is able to support sheltering operations. So we have a non-congregate sheltering operation where our clients up in hotel rooms versus opening a shelter. And that way we're able to follow all the safety protocols, and we are able to do a lot of our work virtually for casework with our clients.
Great. Well, thank you, Ms. Laura Hughes. Really appreciate your taking the time to give us some helpful tips and updates this morning. Appreciate it very much. And parents, I hope you'll go to redcross.org for additional information. We're gonna turn now to Janine Peterson, who is the CEO of the Hamilton Health Center, and she is also joined by Kim Craig, who is the Community Program Manager for Hamilton Health. And Ms. Peterson, let's start with you, and let's just give us an update on Hamilton and specifically how Hamilton Health has been adapting to this current health crisis.
Good afternoon, and thank you for the invitation. Hamilton Health Center is considered an essential provider. So we have been open since the very beginning of the pandemic. We've had to make significant adjustments to our services, including initially closing down 3 of our locations here in the city, 2 of which were in the schools. We have also been looking at the whole issue of social distancing and requiring masking. So Hamilton provides medical services for adults and children. We provide dental services, behavioral health, and social services. And with the, in terms of the number of people that we serve about 30,000 individuals, the vast majority of which live in the city of Harrisburg. And about 10,000 of that number are children ages 18 and younger. So the issues that Representative Kim and Laura talked about in terms of schools has really been an impact on us. The 2 schools sites will close. We have one in Downey and one in Foose. Those will remain closed until the schools reopen. So that has had an impact on our ability to serve our children. Because the schools are going to be virtual, that means that a lot of parents are thinking they don't need to get those child checks and the required immunizations and dental services that are state mandated. We're encouraging all families to continue to make those appointments with their providers so that there's ample time to get those, because eventually the schools will come back in session, in person, and the state is not alleviating those requirements. They are still holding parents to those requirements. So it's going to be very important to get those appointments as early as possible. The social distancing has really been an issue for us. During the pandemic, we had reduced our hours of operation. Most of the residents know that we have evening hours, but during the pandemic, we've only been open 8 to 5. Well, this month we are going back to evening hours, so we're making services more available there. We have a site out on Union Deposit Road and actually on Arlington Road and right behind Union Deposit. That was closed in the initial stages of the pandemic. That is now reopened. Actually, it's a brand new site. We expanded into another building because it was very popular. So we're encouraging people to continue to make those appointments. And during this pandemic, we have pivoted to telehealth services because a lot of people were very concerned about coming into a medical facility. So anytime you're looking to make an appointment, ask if it can be through a telehealth visit. So we're trying to do all of those things to keep our employees as well as our patients safe and healthy. Temperatures are taken at the door, and we're asking specific questions to make sure that people are safe when they come in. If they are ill, we're taking care of them as we always have for the last 50 years. The newest program that we have is really around COVID, and I would certainly like Kim Craig, who is now directing that new program, to really talk about the testing if there aren't any questions for me at this point.
Yeah, maybe we'll come back and talk a little more generally about Hamilton. But yes, let's go to Kim Craig, Community Program Manager for Hamilton Health. And Ms. Craig, very, very pleased you were able to join us here this morning to talk about the issue of testing. I have to say, since we have begun these community conversations every Friday for the past several months, inevitably, the question has come up about testing and why it isn't more prevalent, and why there isn't access to ready testing in the Harrisburg area or in other areas. So I want to take a step back, and I want to talk about the context of that. But let's begin with what is Hamilton Health doing, and what need does it see itself fulfilling with regard to this new testing program that you are embarking on?
Yes, good afternoon, Mayor Pappenfuss. Thank you again for having us. So what Hamilton has done in response for the COVID-19 pandemic is we started the community health program to allow our patients and other residents in the community of Harrisburg to come in to get testing. We are providing mobile testing so that they do not have to come into the building to actually physically be tested for the COVID-19 virus. We are currently testing on location at our 17th Street site, but the long-term goal is actually to travel throughout the Harrisburg community within Dauphin County and surrounding areas.
Okay, so let's go slow here. If I am watching the show and I'm interested in getting tested, what do I do and what will I expect?
So currently, testing, you do not need to make an appointment. We're offering testing in Harrisburg every other weekend. The hours are from 10 a.m. to 2 p.m. And it's every other Saturday. And all you would need to do is come to one of the locations that we would provide the information to where the site would be. And all you have to do is either drive up in a vehicle, or if you're close to the area where we're testing, you can actually physically walk up to that location.
All right. So every other Saturday, 10 to 2 p.m. Is that going to be this Saturday, or is it next Saturday?
The last testing that we provided in Harrisburg was actually this past Saturday,
Okay.
August 15th. We also service the Perry County area, so we will be in Newport on August 29th, but we will be returning to the actual 17th location on September 12th.
Okay, September 12th. And
Yes.
what should people expect in terms of the test? Is this a nasal swab? Is it how does it differ from what somebody might experience at maybe a Rite Aid or somewhere else?
Okay, so what to expect when the test is done? You are correct that this is a nasal swab. This is a self-administered test. There are healthcare workers on site to observe you having the test performed, but it is a nasal anterior swab, which means it's just the inner surface of your nasal passages. And again, somebody will observe you, but you will be able to do the test yourself. And once the test is performed, we send it off to the Quest Laboratories to be tested.
Now, one of the concerns that we're hearing nationally and throughout Pennsylvania is that it's taking a long time to get test results back. You say you're sending it to Quest. What's their turnaround time been, and what would people expect?
Currently, the turnaround time is actually less than 5 days.
Okay, and do I have to have insurance to get this? How you know, if not, what does it cost financially? What is the burden?
You do not have to have insurance. We do collect insurance, but if for some reason your insurance does not cover the test, Hamilton will then bill it to the CARES Act, which is now covering the cost of the test if it is not covered by your insurance or if you do not have insurance.
Okay, so people should not feel that they have to have insurance. They shouldn't feel that they're going to be asked to pay for this test. It is essentially going to be covered one way or the other. Can you tell me how much does the test, just out of curiosity, just so people, you know, what does it cost to do a test like this?
From my understanding, it is about $180 per test.
And that's part of it. So we're going to talk a little bit about now the broader context, and you can feel free to just give your perspective on this. But it does seem that there ought to be access to more widespread testing, and we're very appreciative to what Hamilton Health is doing. And but do you have thoughts on why it is that we're not seeing more of this being done on a wider scale, not only in Harrisburg but really throughout the country?
I can't really explain why it's not being done on a wider scale across the country, but I can say within inner cities, it's a little difficult for the population that we serve to be able to get to the sites where there are testing being performed. So that being the case, we've always tend to serve the more suburban areas, and our goal at Hamilton was to come into the city to provide that service, again, as I stated earlier, so that we could have walk-ups instead of having actually physically to drive up to a location to get tested.
So I know from having spoken to UPMC Pinnacle, one of the issues with testing oftentimes is that you don't necessarily want to mix symptomatic and asymptomatic people, and I know that a lot of people who are currently carrying COVID don't necessarily show symptoms in a traditional way. So if you're coming by, how do you handle the issue of separating the individuals who are getting tested, not just protecting the healthcare workers that are doing the test, but actually protecting people who may be carrying the virus from one another when coming in to get the test?
For those, we try to keep, first of all, the staff are always wearing PPE, so they're always protected. But as far as those who are having symptoms, we do try to encourage them to stay in their vehicles, again, so that they're not actually if they're in their vehicles, so that they're not exposed to anyone else. For those who are walking up that have experienced symptoms, we try to separate them from the other participants that may be in line as well. We encourage everyone to socially distance and stay 6 feet apart. We encourage wearing the mask when you do show up to prevent any of your symptoms to spread to anyone else.
Great. Maybe I'll, Ms. Peterson, if I could return to you just for that same big question. Why do you think it is that we're not able to do this on a wider scale? We know, for instance, that COVID-19 is disproportionately affecting minority communities. What you're trying to do here and what you are doing here at Hamilton Health is a part of the solution and very, very important. But it certainly seems like we don't have the wide, full-scale investment on this from a federal level that we really should.
Thank you for that question, Mayor. We are actually trying to expand our testing initiatives. We have received some federal funds. We are actively recruiting for dedicated staff to do this testing. And as soon as Kim can recruit and hire the staff, we're going to be doing testing every day of the week. The only reason that we're doing it just on a weekend is because we're taking existing staff who have full-time jobs and they're doing overtime. So that 5 days a week, 8 hours a day, they're working at Hamilton, doing their normal work and then working overtime. So we are actively recruiting. These jobs are out on our website. We need individuals who are medical assistants, nurses. We need people who are actually doing the registration. We register everyone so we can do the contact tracing following the test. So, as rapidly as we can get the staffing in place, we will expand this testing. And we're trying to also, at this point, even look, since we're now expanding our evening hours, we're also looking at adding some hours in the evening so staff can, who are willing to work overtime, can offer that testing during the weekday, probably we're looking at 5 to 8. So I think overall, the reason that there hasn't been mass testing in prior, one has been the lack of testing supplies. Those are just recently getting to be more numerous. We also are going to be working with the Pennsylvania Department of Health in obtaining testing supplies. And the turnaround had been a very long, 7 to 14 days. And as Kim said, that's improving as well. So I think the environment is right for us to really do some expansion. We want to get it into the inner city, into the city where a lot of our residents really have not had access to the testing. It's been great that the hospitals have been doing it in the periphery of the city, but for residents who may not be able to drive or, may not want to travel to Hershey or across the river, having services right here in the city is going to be essential. We are also right now in the planning stages of working with the faith community to be able to get the word out to the congregations, to get the sites for this mobile unit that we have at this point. And we anticipate that somewhere around the beginning of September, you'll start to see a lot more of the testing through Hamilton available. I can't really speak about any of the other healthcare services in the region though.
No, thank you for that. That's great to hear, and certainly important during the fall, especially as we move through into the fall and maybe talk about a phased return to a classroom setting for Harrisburg and other school districts. So Hamilton Health is hiring, it sounds like, and that raises a question. I know how much growth you all have had just over the past several years alone. I wonder what the current job climate is like for healthcare workers, especially amidst the pandemic. It can't be easy to fill those positions. Can you talk a little bit about the job market for healthcare workers?
Sure. I have to say that we have been very blessed with an awesome staff who have shown up every day. We have been blessed to have PPE for our staff, so we were not caught in that situation without PPE. There was a lot of advanced planning to get those orders in and delivered. And so our staff are working with the protection that they need. Our biggest issue has really been the childcare situation. The majority of my workforce are women who have children. Oftentimes they're single head of households. And so it's been this huge balancing act of being a parent and also needing to work. So, the fall situation of the schools is also going to impact. But we still have a lot of positions that are available. As I said, we protected our workers. We do screening of all of our employees every day. And so I would encourage people to look on our website and see not only for the testing jobs that Kim is hiring for, but also for other positions that we have.
Great, and we'll put that link out there and encourage people to do that. Kim, coming back to you, talk a little bit more about the testing. So, can you talk a little bit about maybe distinguishing symptoms of COVID-19 from those of the flu? We're about to move into flu season, and it could get confusing for people, and not everybody needs to go in for a COVID test. And presumably, we're going to be promoting flu shots and really encouraging people to get their flu shots too. But can you talk a little bit about that?
That's a really good question that you bring up. The flu and COVID-19 resemble each other in more ways than not. They are both viruses, but the main way to tell the difference for someone who was to say, oh, maybe I think I have the flu, but I'm not sure if I have COVID, maybe I have both. The one thing about the flu, it presents itself within 1 to 4 days after being contracted. Versus COVID-19 can actually take anywhere from 2 to 14 days to actually present symptoms. So that is one of the clear indicators between the two, is the time frame of symptoms.
Interesting. So, do you have general recommendations for who should come in and avail themselves of your testing? Obviously, you can have COVID and not even know it, or you could be symptomatic and very ill. So, what are your general guideline recommendations for somebody watching this? And thinking, do I need to get a COVID test?
Generally, we like to say if you've been exposed to anyone who's had has been positively known to have COVID, if you have any of the symptoms of COVID, or if you just feel like you are presenting any illness that does respiratory symptoms that are unusual from your general allergies or any other prior healthcare conditions that you've had in the past.
Mm-hmm. Mm-hmm. And I guess talking about testing more generally, we could talk a little bit about how this nasal swab test is really a test to determine if you have COVID, but it differs from another test which is out there, which is more of a blood test to determine levels of antibodies. Can you talk about that test, and is that something that Hamilton does?
So at this time, we do not provide an antibody test. The antibody test, as you stated, is done by blood, and that will check to see if you have ever had any of if you've probably possibly had COVID. It does not guarantee that you won't ever catch it again. I know that's been a common myth that if I have the antibodies, that means that I'm now immune to COVID-19. That does not guarantee that. But that is what that test is for. If you were to take the blood test for the antibodies, it would say yes or no that you have possibly either had it or been exposed to it. But we do not.
Right. A different test, equally problematic in the sense that, what does it mean exactly? And will those antibodies actually protect you from getting it again? But it is a test that's out there. And where do you see the future of testing going here over the next months? I know Ms. Peterson has talked about really things, the supply chain improving, tests are starting to be available. If we can get the number of workers we need, that we can ramp up testing. But where do you see the discussion over testing going over the next several months?
I see that it's going to greatly expand, just as Ms. Peterson stated. For Hamilton, we are going to be providing this service throughout the community, offering it to all of this, residents of Harrisburg, if they, wish to be tested and screened. The goal here is to, try to, balance out the disproportion in this community, and give us more of the opportunity to, combat this pandemic. The more people that can get screened, the more we can find who actually has the virus, and that way we can actually treat it. And by contact tracing, we can prevent it and kind of mitigate the spread.
Absolutely, that's the goal. And I just want to say thank you so much for all of your efforts and for all that Hamilton Health is doing to help deal with this pandemic right here in Harrisburg. Momen, I'm going to turn it over to you. I imagine we've got a bunch of questions, especially having to do with the testing discussion, but perhaps talking about how to stay safe or the classroom initiative. So take it away.
Yes, thank you, Mayor. The first two questions we can take to Laura at the Red Cross. Laura, the question is, can someone who has had coronavirus come and donate blood?
That's a great question, and I would direct them to redcrossblood.org because there's a topic hub there that will address all of those questions and more.
Okay, great. Next question, are there volunteer opportunities? And if so, where can people go to find out more information on that?
Question, and I appreciate them asking. We are always accepting new volunteers for a variety of ways that they can support us, either virtually or in person. If they go to redcross.org/volunteer, they can sign up to become a volunteer today.
Okay, great. Next question, actually same question for Janine. How about at the Hamilton Health Center, are there volunteer opportunities for those that want to help out at the center?
Because everything is virtual in terms of outside people coming in and doing services, I'd say the volunteer opportunities are very limited. We are trying to make sure that we aren't having a lot of people coming through the building. We love to show up off our beautiful facility and let people know what's inside, because they're always surprised at how many services are available. But right now, patients and staff are the ones that we are encouraging to be inside. However, as things open up, we're hoping to regain the opportunity for more volunteers.
Great.
And a moment, I'll just add, if people have their clearances, then I think the Community Classrooms Initiative is a great opportunity for people to volunteer in a much needed way. As we know, the school district is returning to virtual instruction. The kids are going to have to sign in, and it's going to be a very different learning environment even than we experienced last spring. This is going to be much more structured and organized, and there's definitely a need for mentors and guidance. So, and I know people can volunteer through the communityclassrooms.org site.
Mm-hmm. Great. Next question is for Kim. If someone has severe symptoms, should they come in physically to get tested, or should they be doing something else?
If you have severe symptoms, we do recommend that you do not come in to get tested.
Presumably, contact their doctor and potentially, seek treatment. You're beyond the need for diagnostic testing. You're in the treatment phase, right?
Correct, and that limits the exposure also to other patients and other staff as well, and then you get quicker medical treatment in a more in a hospital setting.
Right. So and the opposite of that is if you think you may have been exposed, or if you are, that you may have been in contact with somebody that had COVID, but you yourself are not yet showing symptoms, that might be the perfect time to take advantage of a test.
Yep. All right, great, thank you. Just to end here, I think that's all the questions that haven't been answered already. But some websites and the contact information that was mentioned, communityclassrooms.org, and people can go there to enroll their student, or they can also call Representative Kim's office at 717-986-1675. Also mentioned, Red Cross is redcross.org for more information on that. And Hamilton Health Center can be found at hamiltonhealthcenter.com.
Great, Momin. Thank you. Thank you for that. I want to thank all my guests. A lot of great information today. Really appreciate you taking the time to share it with us. And again, if you're watching at home, we'll be back on the topic of police reform next week, and City Council will be back in session virtually this Tuesday. And as we move closer to September, we'll also get you more information about the upcoming Capona and how it is adapting to meet the needs of everyone during this difficult time. So again, I'm Mayor Eric Papenfuss. Thank you very much for watching our community conversations today, and we will see you next week here again live on Facebook at noon next Friday. Take care and stay safe.